Following animation demonstrates design rationale and key product features for the Hand Innovations DVR anatomic plating system. The watershed line is the primary landmark that is used to determine the distal plate positioning. The plate should be just proximal to the watershed line in order to reduce the risk of soft tissue irritation. To identify the watershed line, palpate the radius distally to identify the volar rim of the lunate fossa. Notice that with the plate just proximal to the watershed line, the tendons remain protected from the risk of plate contact. The DVR anatomic plates incorporate fixed angle K-wire holes for provisional plate positioning to aid in the reduction of the distal fragments and allow you to assess the correct peg placement prior to drilling. The intermediate fibrous zone is a 1 centimeter band of fibrous tissue located between the watershed line and the pronator quadratus muscle. The IFZ should be elevated together with the pronator quadratus in order to fully visualize the fracture. After final reduction has been obtained through indirect means using the DVR anatomic as a template, secure the distal fragment using a K-wire through the hole on the ulnar side of the proximal row. A second K-wire can be used on the radial side of the proximal row when extensive comminution is evident. Confirm proper reduction and placement of the K-wire 2 to 3 millimeters proximal to the subchondral plate using fluoroscopy and 20 degrees elevated lateral views. The DVR anatomic optimized radial styloid peg angle helps to capture and support radial styloid fragments. Intersecting proximal and distal rows from a patented three-dimensional scaffold, providing optimal support of the articulating surfaces. Locking pegs and screws provide the strongest peg-to-plate interface. The use of threaded pegs will help to capture dorsal comminuted fragments. The DVR anatomic incorporates preloaded single-use drill guides that are calibrated to the optimal angles, allowing you to accurately place all the pegs and screws without obstructing your view of the fracture site. Apply the plate to the volar surface of the radius and position distally to align the plate to the watershed line. Insert a K-wire into the hole on the ulnar side on the proximal peg row and bend it out of the way to facilitate drilling. Drill through the preloaded single-use fast guide using the 2 millimeter fast drill bit. Insert the fast peg driver into the fast guide until fully seated, and then turn in a counterclockwise motion to remove. Dispose of the fast guide after removal as they are intended for single use. Measure the correct depth for each of the pegs before or after removal of the fast guides using the proper scale on the fast bone depth gauge. Insert each of the pegs using the same fast peg driver until fully seated into the plate. After the first screw has been placed, all other holes can be drilled, measured, and inserted at once. Please be sure to remove all fast guides prior to closing the wound.